Hi there, dog lovers. It's Dr. Karen. In addition to his many other peculiarities, Fred also suffers from reverse sneezing. Now, if you don't know what that means, essentially, reverse sneezing is exactly what it sounds like, the opposite of a sneeze. But instead of the diaphragm contracting and forcing air up through the outer airways to clear anything that's obstructing the sinuses, the diaphragm expands, forcing air down through the sinuses, clearing anything that's actually on the inner surface. Now, when it comes to dogs, that's not usually something like contaminants or dust or anything like that. It's more commonly to do with their anatomy. So when it comes to Fred, the reason he suffers with reverse sneezing is When it comes to Fred, the reason he tends to suffer with reverse sneezing is to do with his size. See, with selective breeding, as his body got smaller, his internal anatomy doesn't necessarily shrink at the same rate. And the result is that he's got tiny head, but his soft palate and his tongue are a little bit too large for that head, while his trachea or windpipe is a little bit too narrow. So the result of that is, on occasion, his soft palate or his tongue will push against his epiglottis, and that triggers a reaction to suck in the air and try to clear that obstruction. And that's what results in this classic sort of reverse sneeze sort of sound. The problem is with a reverse sneeze, the body is trying to move something out of the nasal passages so that it can be swallowed. However, in these cases, what actually happens is that it sucks that soft tissue harder against the windpipe or harder against the larynx or the airways. So we end up seeing sort of almost like a fit of these reverse sneezes until that obstruction is cleared. Because the inner structures or the soft tissue structures within the muzzle and the sinuses haven't shrunk down, this situation is far, far worse when we're dealing with really brachycephalic or squashed faced breeds like pugs or bulldogs or even Cavalier King Charles Spaniels. And sometimes we do see it in the more squashed faced Chihuahuas as well. As that face has gotten shorter, it's basically been compressed. So the result is almost like trying to breathe through a squashed wet rag using one of these cardboard straws. Not very efficient. That's also why these breeds tend to pant more, breathe noisily, snore a lot, and really suffer with things like heat stroke. I'm not overly worried by Fred's reverse sneezing, and this is why. His episodes are few and far between, they tend to be short-lived, and in himself, he's not too panicked or bothered by them. If you've ever seen a dog that suffers with reverse sneezing episodes and they're quite severe, you'll never forget the look of panic in their eyes. I can only imagine it must feel like gasping for air. Dogs that suffer like this, who suffer frequent episodes or severe episodes, should very much be considered for surgery, which often involves trimming the length of the soft palate to reduce the risk of that obstruction happening. In Fred's case, it tends to be quite mild and he recovers really quickly. So going for an invasive surgery certainly isn't warranted in his case. But there are a couple of things that I can do to help him when he's having an episode of reverse sneezing, and they're things that you can do for your dog as well. If you've got a dog like Freddie who suffers with reverse sneezing, the first thing you're going to want to do is speak to your vet just to make sure you've got the right diagnosis. Now, if your dog is having an episode of reverse sneezing, there's a couple of things that you can do to help them out. The first is to vigorously rub at their throat there, even a little bit of a light squeezing of the windpipe or the trachea, and that can just help them open up that area and basically unstick everything. The other thing you can do is called coupage, and that's a way of forcing the air out of the lungs, up through the upper airways, and that also opens up that larynx area. So what you need to do is put one hand flat on one side of the chest. With the other hand, you're going to make a cup, hence coupage. And you're going to use quite firm pressure, but not too hard, to hit the side of the chest. You can see he's not too worried by that, but it just helps push that air out and open up the airways. One further thing that will help your dog if they do suffer with reverse sneezing or any of these brachycephalic airway problems is making sure they're not carrying too much extra weight. Any extra weight is going to increase the amount of soft tissue around these structures, and it's only going to make the problem worse. So for a little guy like Freddie, who unfortunately is prone to gaining weight, we have to be extra careful. Hopefully that will help you and your reverse sneezing dog. But remember, if you have any doubts, or if your dog is reverse sneezing quite a lot and seeming to struggle with it, it's best to talk to your vet.